Wisconsin.
Sir, how much time do I have left?
The gentlelady has 1½ minutes remaining.
Thank you, Mr. Chairman. I would like to yield time to the gentlelady from Connecticut, Mr. Laurel.
How much time?
1 minute and 15 seconds.
The gentlelady is recognized for 1 minute and 15 seconds.
I thank the gentlelady. I think that this is really the height of temerity here to indicate, to make reference to people who are on a food stamp program and make a presumption that because they're on a food stamp program that they are using drugs and that they should be tested. My gosh, I would just say that what about those people who are getting $4.7 million in direct payments from the federal government, as the gentleman from California does, an additional $1.2 million from direct payments from the federal government. Maybe we ought to start drug testing all of the people who get some sort of a benefit from the federal government, and particularly those folks in this program, like the folks who are crop insurance. We can't find out the names of the 26 individuals on crop insurance that get at least $1 million. $1 million they get in a premium subsidy. And you know what, my friends? They don't have to have, there's no cap on the amount of money. There is no threshold on what they can receive. They have no eligibility criteria. They just get the money, and they don't even have to farm the land. Why don't we drug test those folks today and not demean people who have fallen on hard times?
Time of the gentlelady has expired. The gentleman from North Carolina.
May I inquire as the amount of time remaining, sir?
The gentleman has 1 minute remaining and the right to close.
Thank you, and I will yield myself the balance of the time.
The gentleman is recognized for 1 minute.
Thank you, Mr. Chairman. Again, I ask my colleagues to consider this as a common sense measure that does nothing to take food away from those who need it, but it makes sure the integrity of this program is withheld. We don't make any presumptions about folks on the program, but we think that states need this tool so that they can make sure that folks who are on the program are the folks who need to be on that program. And I thank the gentlelady, my colleague from Connecticut, for endorsing this farm bill this year, because we do eliminate direct payments. And as she alluded, I agree. That's something that practice that we should end. And so I appreciate her endorsement of that piece of it. And so, Mr. Chairman, with that, I'll conclude by just saying I urge my colleagues to support this common sense measure that does nothing but allow the states to have the tool to use drug testing should they see fit when administering this program. With that, I yield back the balance of my time. Thank you.
Gentleman yields back his time. The gentlelady from Wisconsin is recognized for 15 seconds.
Thank you, Mr. Chairman. This is not commonsensical. This is unconstitutional. This is a proxy for the majority wants to excuse itself from taking food away from 46 million people who are hungry, and it's a proxy for criminalizing the food stamp program in order to get away with it.
The gentlelady has expired. Question is on the amendment offered by the gentleman from North Carolina. As many as are in favor will signify by saying aye. Those opposed will say no. Opinion of the chair, the ayes have it. The ayes have it. Amendment is agreed to. It is now in order to consider amendment number 23, printed in Part B of House Report 113-117. For what purpose does the gentleman from Texas rise?
Mr. Chairman, I have an amendment at the desk.
The clerk will designate the amendment.
Part B, amendment number 23, printed in House Report number 113-117, offered by Mr. Conaway of Texas.
Pursuant to House Resolution 271, the gentleman from Texas, Mr. Conaway, and a member opposed will each control 5 minutes. The chair recognizes the gentleman from Texas.
Thank you, Mr. Chairman. I offer this amendment because serious reforms to the SNAP program are difficult. Because the program continues on autopilot even after the Farm Bill expires. SNAP is defined as an appropriated entitlement, meaning that appropriations can continue to fund the program regardless of action taken by the Ag Committee. This amendment is about the accountability of SNAP. While SNAP funding is provided in the Annual Appropriations Act, the level of spending for appropriated entitlements is not controlled through the annual appropriations process. Instead, the level of spending for appropriated entitlements, like other entitlements, is based on the benefits and the eligibility criterion established in law. The amount provided in Appropriations Acts is based on the projected level. In general, the maximum SNAP benefit is set at 100% of the USDA's Thrifty Food Program or plan. TFP is calculated each year by USDA as the lowest cost food plan and varies by household size. Benefits are further reduced by 30% of a qualifying family's annual income on the expectation that families contribute to their own food purchases. This amendment would simply reduce by 10% the Thrifty Food Plan calculation in any year that SNAP is not authorized, otherwise bringing the Agriculture Committee back into the operations. In this way, all parties would have an incentive to come to the table and negotiate a SNAP reforms while drafting the next Farm Bill. It's important to note that this amendment does not end SNAP, nor is it expected this amendment will actually ever go into force. It simply lowers the benefit if and only if Congress fails to reach an agreement on how to reauthorize the SNAP program. Further, it does not impact the baseline for this year's Farm Bill and does not cost any money to implement. Mr. Speaker, I urge adoption of this amendment, and I reserve the balance of my time.
The gentleman reserves his time. For what purpose does the gentlelady from Connecticut rise?
Mr. Speaker, I rise to claim time in opposition to this amendment and yield myself as much time as I may consume.
The gentlelady is recognized for as much time as she may consume.
This is unprecedented. This far-reaching amendment would quite literally hold millions of our country's poorest children, working families, seniors, the disabled hostage to this Congress's ability to compromise and pass a farm bill. That is almost laughable. This Congress hasn't been able to come to an agreement or a compromise on anything. And if the Farm Bill is not reauthorized by September 30th, food stamps for all families of 4 would be cut about $64 a month. Right now, more than 47 million Americans, including more than 19 million children, rely on food stamps to put food on the table. They don't rely on the program because they want to. They rely on the food stamp program because they have no other choice. They either do not make enough money to afford food for their family because of the paltry minimum, or they are temporarily unemployed because of the historic economic recession this country has experienced. This is a misguided amendment. It would impose steep cuts for each and every one of the households. The nonpartisan Center on Budget and Policy Priorities estimated that passing this amendment could result in nearly 15% cut for households. That's $64 for a family of 4 when they only receive an average of less than $430 a month. Already 90% of SNAP benefits are redeemed by the 3rd week of the month, around the same time that food banks see more and more men, women, and children enrolled in the program turning to the food bank because their benefits ran out. All social safety net programs, including food stamps, have historically been protected from automatic across-the-board cuts. This was true in the laws enacted in 1985, 87, 1990, 2010, the Budget Control Act of 2011. SNAP was also protected in Simpson Bowles, which recognizes the need not to reduce the deficit on the backs of the poor and the most vulnerable in this country. Christian leaders continue to call on this body to form a circle of protection around programs that help the neediest Americans, including those on food stamps. The circle of protection should surround this amendment. I urge my colleagues to heed that request and to oppose this amendment, and I reserve the balance of my time.
Gentlelady reserves her time. The gentleman from Texas.
Mr. Speaker, or Chairman, I don't have any other speakers, and I believe I have the right to close. So I reserve.
The gentleman has the right to close. He reserves his time. The gentlelady from Connecticut.
Mr. Chairman, Mr. Speaker, can you tell me how much time remains?
The gentlelady has 2½ minutes remaining.
Let me get a minute and a half to 2 minutes to the gentleman. 1 minute. Okay.
Gentleman is recognized for 1 minute.
I want to thank the gentlelady for yielding. So let me get this straight. So if Congress doesn't do its job, we don't get punished. Poor people get punished. I think we have it backwards here. Why should we hold poor people hostage to the fact that somehow this Congress can't get its act together? We don't hold people who receive subsidies, other subsidies who are quite frankly well off. We don't hold them accountable for our lack of ability to get things done around here. But this is yet another in a series of amendments to diminish the plight of poor people, to demonize programs like SNAP, and I really think it's unfortunate. I mean, we're going to punish poor people because we can't reauthorize the Supplemental Nutrition Assistance Program. What a terrible idea. And I hope that my colleagues on both sides of the aisle will agree with us on this and reject this. I yield back the balance of my time.
How much time remains?
The gentlelady has 1.5 minutes remaining.
I thank you, and I think it's really rather incredible that we once again in the prior amendment have singled out a group of people, and many of whom today were people who were working, who lost their jobs through no fault of their own, and find themselves in a situation where they have to access the food stamp program in order to feed their families. On the other hand, those people that I singled out earlier, the 26 individuals who get at least $1 million in a premium subsidy for crop insurance, and they have no income thresholds at all. These folks, if we can't get to a compromise, they'll continue to get what they're getting. They're eating well. I would bet they have more than 3 squares a day. Let's think about who this amendment targets. 76% of SNAP households include a child, senior, or disabled individual. The average household in SNAP has a gross monthly income of $744. Average SNAP allocation is already less than $1.50 per meal. 55% of SNAP dollars go to households with income below half of the federal poverty line. This targets the poorest. It asks them to pay a price for congressional farm bill politics. Let's talk about the members of Congress. If they can't get to a compromise, let's make sure they don't get their salaries, and that we do something to those who are responsible for not getting the job done. Don't take it out on the poorest people in this nation. This is unprecedented. It is immoral. I urge my colleagues to oppose this amendment.
Time of the gentlelady has expired. The gentleman from Texas.
Thank you, Mr. Chairman. Many of the arguments that have just been made speak to why we need to do this deal. We need that sense of urgency that's portrayed on the other side to get this farm bill done. Now, this amendment won't take effect until the next farm bill. But right now, this farm bill is only production agriculture and the conservation programs are trying to drag this program across the finish line with 218 votes. The nutrition program and their supporters couldn't give a rat's rear end whether or not it gets passed, because their program goes forward without any effect if we don't do anything. So they're really at an advantage to production agriculture. And so this is not about SNAP program. This is not about the benefits. This is simply saying, I don't necessarily think SNAP is perfect. And the only way to get out of SNAP reform is to have the SNAP beneficiaries, which are in every single congressional district, as opposed to farmers, which are in not every single in every congressional district, to bring them to the table, to have some skin in the game, to make sure that they're communicating to their members of Congress that they want them to get something done. Right now, they're just simply on the take side, and they're not part of the process. And they don't have to be, because of the way we've done these rules. Argue and flame against the rules of the House. Don't argue about the idea that we must do our job. As congressmen, we do our jobs. I've got folks who back home who motivate me to do it far more than anything else that's up here. So this amendment would simply say SNAP has a role, and the SNAP beneficiaries have a role in communicating to their member of Congress to get this work done on a timely basis. I urge support of the amendment, and I yield back.
The gentleman yields back his time. The question is on the amendment offered by the gentleman from Texas. As many as are in favor will signify by saying aye. Aye. Those opposed will say no. No. Opinion of the chair, the noes have it.
You ask for a recorded vote.
Pursuant to Clause 6 of Rule 18, further proceedings on amendment offered by the gentleman from Texas will be postponed. To consider amendment number 24, printed in Part B of House Report 113117. It is now in order to consider Amendment number 25, printed in Part B of House Report 113-117. For what purpose does the gentleman from North Carolina rise?
I have an amendment at the desk.
The clerk will designate the amendment.
Part B, Amendment number 25, printed in House Report number 113-117, offered by Mr. Butterfield of North Carolina.
Pursuant to House Resolution 271, the gentleman from North Carolina, Mr. Butterfield, and a member opposed will each control 5 minutes. The chair recognizes the gentleman from North Carolina.
Thank you very much, Mr. Chairman. Mr. Chairman, I rise to propose an amendment to the nutrition title of this bill. I will mention in the outset that my amendment has been scored by the Congressional Budget Office as budget neutral and not adding to direct spending. Mr. Chairman, my amendment is very simple. It will expand the items available for purchase under the SNAP program to include items of personal hygiene. Historically, the purpose of the SNAP program has been to provide financial assistance to poor individuals to purchase food. Nearly 50 million people in this country currently rely on SNAP benefits to provide food for themselves and their families. No one wants to depend on SNAP for their next meal, but we have a responsibility to our neighbors to provide and care for them in their time of need. But for the poor, need does not just stop at food. While SNAP currently provides financial assistance to purchase certain types of food, there is no mechanism to help needy people purchase personal hygiene items like toothbrushes and toothpaste and toilet paper and feminine items, among other items used for their personal care, items that they cannot afford. My amendment expands SNAP-eligible purchases to include personal hygiene items to be determined by the Secretary of Agriculture. Ensuring that poor families have access to personal hygiene products is the right thing to do. Giving families the ability to purchase personal hygiene products will save us money in the long run. Poor personal hygiene can have far-reaching consequences on an individual's health and result in more trips to the emergency room and increased uncompensated care. Research indicates the lack of proper dental hygiene can increase the risk of heart attack and stroke, exacerbate diabetes and kidney disease, and for expectant mothers can increase the risk of delivering a preterm, low birth weight baby. Mr. Chairman, at a time when we are coming out of this recession and state governments across the country like the one in my home state of North Carolina are refusing to expand Medicaid, now is the time to give our most vulnerable citizens some flexibility to buy products that will improve their long-term health. It's especially critical as we stand here today to debate this $20.5 billion cut to the SNAP program. And so, Chairman Lucas and all of those responsible for this bill, thank you for the work that you've done, and thank you for allowing me time to speak this evening. I yield back. I reserve my time.
The gentleman reserves his time. For what purpose does the gentleman from Arkansas rise?
I claim time in opposition.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chair, and I would yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
The Supplemental Nutrition Assistance Program is just that, a nutrition assistance program. It's designed to provide nutrition assistance to eligible low-income individuals and their families. Personal hygiene items never have been eligible for purchase under the Supplemental Nutrition Assistance Program transaction and should never be eligible under SNAP. We should be devoting our scarce resources to provide food to hungry Americans, not personal hygiene items. I urge my colleagues to join me in opposition to this amendment and vote no, and I reserve the balance of my time.
Gentleman from North Carolina.
How much time is remaining, Mr. Chairman?
The gentleman has 2.5 minutes remaining.
At this time, I'll yield such time to the gentlelady from Wisconsin as she may consume.
The gentlelady from Wisconsin is recognized for as much time as she may consume.
Thank you so much, Mr. Chairman, and thank you, gentleman from North Carolina. I think that the majority has really raised the point that historically we have not allowed purchases beyond food for the food stamp program. But it's not that poor people don't really need to be able to do that. This amendment is very, very narrow. And I can recall from personal experience some of the things that many families run out of in a family that are directly related to their nutritional needs, like a baby bottle. You've never seen a family frantically trying to find the last baby bottle or a nipple that the baby is bitten off of and not be able to deliver the formula to the child because they don't have a baby bottle. And it'll cost over $2 to be able to make that purchase. Certainly, toilet paper is sort of inversely related to eating. And, you know, the need for feminine hygiene products is something that just, or deodorant, is something that adds to the dignity of being alive. I mean, it is quite true that many Americans during our Great Recession only had food stamps to depend on, not even TANF benefits. And so if you're looking for a job, you really do want to have deodorant and toothpaste to be able to make that. So I think that this is budget neutral, and it is a small concession to make given the draconian cuts we're making in the program already. And I yield back.
Gentlelady yields back her time. The gentleman from
and
Arkansas.
Reserves.
The gentlelady yields back her time to the gentleman from North Carolina. Gentleman from North Carolina.
I will reserve the balance of my time.
The gentleman reserves his time. The gentleman from Arkansas.
I reserve. I'm prepared to close if the gentleman has no further speakers.
The gentleman from Arkansas has a right to close. The gentleman from North Carolina.
Thank you very much, Mr. Chairman. I'm going to ask my colleagues if they would look very closely at this amendment. It's not a radical amendment. It simply empowers those recipients of SNAP to buy very simple, basic items that are related to nutrition, such as toilet paper and toothpaste and toothbrushes and the like. I ask my colleagues, please, to allow an up or down vote on this and to vote aye on the amendment.
Gentleman yield back his time.
I yield back all of my time.
Gentleman yields back his time. The gentleman from Arkansas.
Thank you, Mr. Chairman. I respect the initiative here. I appreciate that. I think that we're kind of wandering into uncharted waters here because we're talking about a farm bill and a nutrition title, and this is not, I don't believe, in our purview to authorize the use of nutrition funds to address personal hygiene items, and that's why I have reservations about this. So I appreciate the effort put forth here and totally recognize the value of personal hygiene. I'm a big believer in personal hygiene, and so I just don't think that it's appropriate for us to address personal hygiene items in the context of nutrition. So for that reason, I would respectfully request a no vote on this amendment and yield back.
Gentleman yields back his time. The question is on the amendment offered by the gentleman from North Carolina. As many as are in favor will signify by saying aye. Those opposed will say no. Opinion of the chair, the noes have it. Gentleman from North Carolina.
Mr. Chairman, I ask for the yeas and nays.
Pursuant to Clause 6 of Rule 18, further proceedings on the amendment offered by the gentleman from North Carolina will be postponed. It is now in order to consider Amendment Number 26, printed in Part B of House Report 113-117. What purpose does the gentleman from Pennsylvania rise?
Sorry, I have an amendment.
The clerk will designate the amendment.
Part B, Amendment Number 26, printed in House Report Number 113-117, offered by Mr. Marino of Pennsylvania.
Pursuant to House Resolution 271, the gentleman from Pennsylvania, Mr. Marino, will recognize for and a member opposed will each control 5 minutes. The chair recognizes the gentleman from Pennsylvania.
I yield myself as much time as I may consume. Mr. Chairman.
Recognized for as much time as he may consume.
Mr. Chairman, my amendment is simple. This amendment finally brings some transparency and public accountability to the $80+ billion food stamp program. It directs the Government Accountability Office to establish a pilot program in 9 states that will allow the GAO to collect and make public information showing how our food stamp dollars are being spent. As a prosecutor, I presented all of the facts to the jury so that they were able to make an accurate decision based on the evidence. It is inconceivable to me that at a time when all Americans are demanding accountability and transparency in government, we are allowing $80+ billion a year to go out the door with virtually no idea on how it is being spent. To put that into context, $80 billion a year is more than double the amount of money the Department of Homeland Security received in the appropriation bill we approved on June 6, and roughly the same amount that was cut by sequester. I have had several interesting arguments made to me against this bill, driven primarily by big business who are more interested in protecting profits rather than taxpayers. Opponents have argued that this would be costly for retailers to implement. First, the information required to be reported and made public is information that retailers are already required to keep under existing law. I also find it ironic that opponents are arguing that because there may be a compliance cost for a program that is voluntary for retailers, we should just forego any meaningful oversight over how these taxpayer dollars are being spent. Some opponents claim that this is food surveillance. This amendment is not food surveillance. It is oversight and accountability. At a time of high debt and deficit, it is incumbent on Congress to scrutinize fully every federal dollar spent. I have also heard opponents argue that SNAP is efficient because USDA says that it only has a 3.8% error rate. This is a false red herring argument that is meant to distract from what this amendment would do. The error rate referred to involves the percentage of benefits that either went to ineligible households or went to eligible households, but in excessive amounts. The error rate has nothing to do with how the taxpayer dollars are spent. Having that information is critical, especially as we debate things like how much to scale back the SNAP program or whether it is inappropriate to allow the purchase of certain items with SNAP dollars. I have heard that there were no hearings about the SNAP program in conjunction with this Farm Bill. I agree that there should have been hearings. Nevertheless, those hearings would be more productive if they had all the information as to how programs are operating. My amendment would give us and the American people the ability to make informed policy decisions about the program. That is why my amendment is supported by a range of groups, from the Physicians Committee on Responsible Medicine to Americans for Limited Government. Mr. Chairman, again, I want to emphasize that this amendment is about transparency. It is about oversight and accountability. We have to have the facts at our disposal to determine what, if anything, to do. It is about good government. I urge my colleagues to join me in support of this common sense amendment. I reserve the balance of my time.
The gentleman reserves his time. For what purposes, gentleman from Georgia rise?
To claim time in opposition.
The gentleman is recognized for 5 minutes.
Mr. Speaker, this is one of the most terrible amendments that has ever been brought before this House of Representatives. It goes against the very grain of what America is about. And I don't care if you're rich, I don't care if you're poor, I don't care if you're in the service, I don't care if you have to have SNAP. You are an American. And Americans right today, if they're tired of one thing, they're tired of the government prying into their lives under a surveillance that's happening right now on the 6 o'clock news, on our major papers. The one thing is the mistrust of a government surveillance program. This has everything to do with surveillance. It's exactly what it is. It's a food surveillance program from my good friend, Mr. Tom Marino. What this will do, you tell me if it isn't. It will require retail food stores to monitor, to put in a surveillance system, to collect and report back to the Secretary of Agriculture detailed information that identifies what food items, what type, what size are purchased by those who are on SNAP. Now, this isn't about SNAP. You've gone into the grocery stores. Everybody goes into that grocery store as an American to purchase, to buy the food, the basic things that he needs to survive. You can't put a surveillance on the SNAP person without putting a surveillance on every American that goes into that store. How asinine such an amendment this is. In this eagerness of this declaring of war on SNAP recipients, We're declaring a war on the soul of America itself. And I don't care if you're liberal, I don't care if you're moderate or you are conservative. Every American ought to be concerned about this. You're not going to be able to put a surveillance program over what the SNAP folks get without putting a surveillance program over all Americans. Just think. Look how big our system is. The statistics bear it out. Right now, there are over 460,000 different items on the market shelves. There are 15,000 new ones going on every year. What's going to happen there? And for the consumers, there's going to be a cost. Yes, there's going to be a cost. But these retailers don't go and print money and make it. You know who's going to pay for that cost? For this surveillance program that is unneeded? It's going to be the customers. And so, ladies and gentlemen, and with all due respect to the gentleman, let us ease this war against the poorest who are among us. I remind everybody every day that the fastest growing group of recipients who are receiving benefits from food stamps are our veterans, the very ones who've gone and have put their lives on the line, who come back maimed, that have to depend upon food stamps, who went and fought overseas so we could be free from surveillance. And here's an amendment that wants to put a surveillance on them. Let's look at this and see it for what it is. It is an awful surveillance program, and I have respect for the gentleman, but it's totally misguided and does great damage to the heart and the soul of this nation, because you cannot discriminate going into those grocery stores against the poor recipient of SNAP without discriminating and taking away the freedoms of every single American.
Time of the gentleman has expired. Gentleman from Pennsylvania.
I reserve my time if
The gentleman's time has expired.
All right. Okay, I will close then. How much time do I have?
Gentleman has 1 minute remaining.
Okay. You know, keeping track of this, it's already done by a barcode, so there's no additional cost. And there's no surveillance, there's no cameras, there's nothing checking on anybody. We're not asking who is buying, we're asking what is being purchased. With my colleagues, it's always a war. It's a war on women, it's a war on this, now it's a war on people using food stamps. We should be doing this anyhow. It's a law that should be done by the stores that's just not being enforced. Hard-working taxpayers deserve the accountability. They deserve to know how their $80 billion is being spent and on what. I wonder what my friend across the aisle is concerned about, perhaps what the results may show. But we don't know at this point. So the American people are entitled to know how their money is being spent. And as I said, there's no cost associated with this. They're doing it by barcode anyhow. Everything that goes through a store now is barcoded. So it's just reporting the information. If anything is misguided, what is misguided is $80 billion in 2012 and $82.5 billion projected in 2013 that's going to be spent, and there's no accountability for it. I yield back my time. Thank you.
Time of the gentleman has expired. The question is on the amendment offered by the gentleman from Pennsylvania. As many as are in favor will signify by saying aye. Those opposed will say no. Opinion of the chair, the ayes have it. The ayes have it. Pursuant to Clause 6 of Rule 18, further proceedings on the amendment offered by the gentleman from Pennsylvania will be postponed. It is now in order to consider Amendment 27, printed in Part B of House Report 113-117. For what purpose does the gentleman from Ohio rise?
Mr. Chairman, I have an amendment at the desk.
The clerk will designate the amendment.
Part B, Amendment number 27, printed in House Report number 113-117, offered by Mr. Shabbat of Ohio.
Pursuant to House Resolution 271, the gentleman from Ohio, Mr. Shabbat, and a member opposed will each control 5 minutes. The chair to recognize the gentleman from Ohio.
Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Thank you. I introduced this amendment to reform the Supplemental Nutrition Assistance Program, the Food Stamps or SNAP program, and specifically the Electronic Benefit Transfer Account program within the SNAP or within the Food Stamp program. The SNAP or Food Stamp program is in dire need of reform, and I think most people realize that, and a lot have spoken out about that already. Under the current administration, the Obama administration, the number of people on food stamps has increased by 16.5 million persons. In 2011, the SNAP program handed out $84 billion in food stamps in 1 year alone. The SNAP program is now the second most expensive, after Medicaid, program, and it's the fastest growing of all the federal government's 80 welfare programs. This cost is unsustainable. Reforms can be made without impacting, in my belief, those who truly need assistance, and there are some who truly do need assistance, and we ought to help them. Under current law, unused benefits are rolled over each month and can pile up for an entire year. The current law is terribly flawed and encourages fraud and abuse. My amendment would increase the integrity of the program by ending the rollover and recouping leftover benefits. Instead of allowing benefits to remain unused and account for an entire year, my amendment would return unused SNAP or unused food stamp money or benefits to the U.S. Treasury after 60 days, 2 months, which I believe is a very reasonable period of time. Those actually using the benefits or those truly in need would not be impacted. The intent of SNAP or food stamps is to assist those in need on an as-needed basis. If a recipient hasn't utilized all their benefits, those benefits could be used to help others who do need them or used to reduce our almost $17 trillion national debt. Clearly, this is a program in need of reform. My amendment addresses the out-of-control growth that we have witnessed with this program over the past 4 years, and I would urge my colleagues to support this amendment, and I would recognize, I'd be happy to yield to the gentleman.
I thank the gentleman for yielding, and I would just like to say on behalf of the chairman of the Agriculture Committee, I thank the gentleman from Ohio for bringing this good government amendment before us today. Current law states that a state agency must return unused benefits to the Treasury after a 12-month period of inactivity. The gentleman's amendment simply shortens that time period that the SNAP recipient has to claim their benefits to 60 days. I would urge my colleagues to vote yes on this common sense amendment, and I would yield back to the gentleman from Ohio.
I thank the gentleman. I'll reclaim my time and reserve the balance of my time.
Gentleman reserves his time. Does any member wish to claim time in opposition? If not, the gentleman from Ohio is recognized.
Mr. Chairman, I'll just make a couple more statements and I'll yield back. I would also note that almost 80% of the Farm Bill, or spending about $1 trillion overall, goes to the food stamp program. So we're talking about a very significant part of the overall Farm Bill. The GA notes in a report, and I quote here, "It's inconclusive regarding whether SNAP or food stamps alleviates hunger and malnutrition in low-income households." Think of that. It's inconclusive whether or not it actually reduces hunger or malnutrition in the people it's supposed to be helping, which is low-income households. If that's the case, you know, why are we spending all these dollars? And this doesn't go to the entire food stamp program. Obviously, it just goes to a certain item, and that's reducing from a year, allowing those dollars to pile up to a reasonable time, which is 2 months. I would also note that the GAO report goes on to say that the amount of SNAP money paid in error is substantial, totaling in the billions of dollars. So it's clearly something that should be reformed, and if there are no other speakers, then I will yield back the balance of my time.
Gentleman yields back his time. The question is on the amendment offered by the gentleman from Ohio. As many as are in favor will signify by saying aye. Those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. It is now in order to consider Amendment 28, printed in Part B of House Report 113-117. For what purpose does the gentlelady from Texas rise? Or Tennessee. I knew that.
Thank you,
Tennessee.
Mr. Chairman. I have an amendment at the desk.
The clerk will designate the amendment.
Part B, Amendment number 28, printed in House Report number 113-117, offered by Mrs. Black of Tennessee.
Pursuant to House Resolution 271, the gentlelady from Tennessee, Ms. Black, will be, and a member opposed will each control 5 minutes. The chairlady recognizes the gentlelady from Tennessee.
Thank you, Mr. Chairman. I yield myself as much time as I may consume.
Gentlelady is recognized for as much time as she may consume.
I rise today to speak in support of my amendment to officially end the agreement between the USDA and the Mexican government known as the Partnership for Nutritional Assistance Initiative. Now, this partnership began back in 2004, but it has greatly expanded under the Obama administration. It's an aggressive outreach program funded by the U.S. taxpayer dollars, which promotes SNAP enrollment in targeted communities by partnering with Mexican government officials to hold meetings, health fairs, and coordinate other outreach initiatives designed to bring working-class families into public assistance and dependence programs. Not only is this an ill-conceived partnership with Mexico, promoting a life of dependency rather than upward mobility, there is no reason to believe that the Obama administration isn't just using this partnership as a way to get illegal immigrants enrolled in the SNAP programs. This current partnership is among the most egregious examples of policies contributing to the 46% expansion in SNAP recipients under the Obama administration, and it must stop now. My amendment today is an opportunity for Congress to be good stewards of our taxpayer dollars, our hard-working taxpayer dollars, and to get the U.S. government out of the business of promoting dependence. I urge my colleagues today to vote in support of my amendment to terminate this partnership with the Mexican government. Let's stop this blatant misuse of the taxpayer dollars so that SNAP is there for those who have fallen on hard times and truly need temporary assistance, not for exploitation by foreign governments. And with that, Mr. Chairman, I yield to the gentleman from Arkansas.
I thank the gentlelady from Tennessee for yielding, and on behalf of the chairman of the Agriculture Committee, would like to thank her for bringing this amendment to avoid the partnership with the Mexican government that promotes participation in the SNAP program. We support this amendment, urge our colleagues to vote yes, and with that I yield back to the gentlelady from Tennessee.
Mr. Chairman, I reserve the balance of my time.
Gentlelady reserves her time. Does any member seek time in opposition? If not, the gentlelady from Tennessee is recognized.
Thank you, Mr. Chairman. This is so important that we are assured that our hard-working taxpayer dollars are used for those that are the most in need as a safety net and not to be given to foreign governments. And so I ask support for this amendment. Yield back.
Gentlelady yields back her time. The question is on the amendment offered by the gentlelady from Tennessee. As many as are in favor will say aye. Those opposed will say no. Being the chair, the ayes have it. The ayes have it. The amendment is agreed to. It is now in order to consider Amendment number 29, printed in Part B of House Report 113-117. For what purpose does the gentlelady from Ohio rise?
Mr. Chairman, I rise I have an amendment at the desk.
The clerk will designate the amendment.
Part B, Amendment number 29, printed in House Report number 113-117, offered by Ms. Capter of Ohio.
Pursuant to House Resolution 271, the gentlelady from Ohio and a member opposed will each control 5 minutes. The chair recognizes the gentlelady from Ohio.
I thank the chairman and yield myself such time as I may consume.
Gentlelady is recognized for as much time as she may consume.
Mr. Chairman, the amendment I'm offering today would create a clear set-aside for senior citizens in the Farmers Market Nutrition Program. Senior hunger is a serious and growing problem, sadly, in our country. Feeding America estimates nearly 5 million seniors. 5 million. 1 in 12 in 2011 were food insecure, double the number in 2001. With prices up and with what's happening across this country, we know that that number is not the top, but probably the base, and it's probably more. So senior hunger is a growing problem, and we know the costs of food are up. In fact, 6% of households with an elderly person are definitely food insecure. And we know that women over the age of 85 have a poverty rate of 13.8%. That means elderly women have the second highest poverty rate in the nation. This is a great country. No single senior citizen in our country should ever have to worry about food. I remember one senior center that I went to for a small little lunch, and they put these tiny sandwiches on the plate and they cut them in half. And I remember a senior woman, very frail, very elderly, she took half a sandwich and ate it, and then when she thought no one else was looking, she wrapped up the other half of the sandwich and put it in her purse. It's just, unless you really see it, you don't realize how painful it is for millions of seniors across our country. Senior hunger has a health impact because food insecurity among elders causes more headaches, more dehydration, more disability, more decreases in resistance to infection, more high blood pressure, and extended hospital stays. In fact, food-insecure elderly persons have been found to be over 2 times more likely to report poor or fair health. Ultimately, the health impact of hunger results in higher health care costs. In an effort to help address this serious problem of senior hunger, Congress created the Senior Farmers Market Nutrition Program. It is a very popular and very effective program. It is so small and meagerly funded, it doesn't even function in every congressional district in this country. But the program is a home run for seniors who need help, and it's a home run for local producers. The program brings together needy seniors who purchase fresh and nutritious locally grown fruits, vegetables, honey, and herbs at their local farmers markets, roadside stands, and community-supported agriculture programs. In effect, seniors help farmers, and farmers help seniors. Farmers expand their customer base, and seniors buy fresh vegetables, fresh fruits, fresh honey, locally produced, which helps to combat many allergies which are growing across this country, and obviously herbs. The program helps local food production because farmers sell their agricultural products locally, at local places, with direct marketing. There are similar programs for WIC participants, but unfortunately the discretionary funding for the program has been declining. It is my hope that as we go to conference with the Senate, we can look at the changes in the underlying bill and increase mandatory funding for a unified program. From my perspective, a unified program holds the potential to serve the more needy seniors, which will help combat senior hunger. Given the damage sequestration is doing to Meals on Wheels and other senior assistance programs, I hope we can work on a bipartisan basis to support our seniors, the most vulnerable among us. I urge adoption of the amendment and reserve the balance of my time.
Gentlelady reserves her time. Who claims time in opposition? Gentlelady from Ohio is recognized.
Thank you. Mr. Speaker, I have been given every indication that this amendment is going to be acceptable to both sides, and I would urge my colleagues to support it, and I yield back my remaining time and ask for a favorable vote.
Gentlelady yields back her time. The question is on the amendment offered by the gentlelady from Ohio. As many as are in favor will signify by saying aye. Those opposed will say no. In the opinion of the chair, the ayes have it. The ayes have it. The amendment is agreed to. It is now in order to consider Amendment Number 30, printed in Part B of House Report 113-117. For what purpose does the gentleman from Arizona rise? The clerk will designate the amendment.
Part B, Amendment Number 30, printed in House Report Number 113-117, offered by Mr. Schweikert of Arizona.
Pursuant to House Resolution 271, the gentleman from Arizona, Mr. Schweikert, and a member opposed will each control 5 minutes. The chair recognizes the gentleman from Arizona.
Mr. Chairman, I yield myself as much time as I might.
Gentleman is recognized for as much time as he may consume.
Mr. Chairman, and I'm sure this is true for all of us in the body, both on the right and the left, as we grind through the amendments and look at them, we on occasion come across an amendment that you can actually see where it was well-meaning. It may have had a good heart behind it. But when you sort of dice it up, you start to actually understand both something from a personal basis almost borders on the humorous side, but also structurally has some real problems. I stand up today trying to remove some language, the Healthy Food Finance Initiative. And look, we'll have some members who will say, it's only $125 million. But understand that $125 million may be used to buy a grocery store, to subsidize certain healthy food products in areas where the program deems there is a shortage of such. Where there's an amazing irony is, okay, we want healthy foods. There's some areas that the products that may be available in those areas we deem not to be particularly nutritious, but that may be because in our commodity subsidy system, what's in our grocery stores? The fact of the matter, processed foods, because we subsidize commodities. And then I go in and say, but my solution is I'm going to create another subsidy to take care of the problem on the other side. At some point, you've got to be willing to take a step back and see the irony in this. But there's also other structural problems. We're basically taking taxpayer money, and through sort of a network, you may find a private grocery store being financed by taxpayer money. You may be finding the system where certain foods and certain retailers being financed by taxpayer money just because it's designated as an area where these products don't exist. So with that, I retain the balance of my time.
The gentleman from Arizona reserves his time. For what purpose does the gentlelady from Ohio rise?
Mr. Chairman, I rise in opposition.
The gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I rise in opposition to the Schweikert Amendment to strike the Healthy Food Financing Initiative. Let me just say that not only is it well-meaning, it works.
Right to close.
And it's about time this Congress does something that is proven to work. This amendment removes from the Farm Bill bipartisan language that I successfully championed during the House Farm Bill markup. The Healthy Food Financing Initiative outlines a comprehensive federal response to addressing the limited and inequitable access to healthy foods in low-income communities in both rural and urban America. It does this through the creation of a national fund manager housed within USDA that would improve access to healthy foods, create quality jobs, and revitalize low-income communities by providing loans and grants to eligible food retailers. Nearly 30 million people live in low-income areas more than 1 mile from a supermarket, which means they lack adequate access to fresh, healthy, and affordable food. It comes as no surprise that these same people are less likely to have a healthy diet than those with better access. Barriers to healthy food have worsened the growing epidemic of obesity, diabetes, and other diet-related health problems in these communities. The Healthy Food Financing Initiative would combat the lack of healthy food retail through a public-private initiative that would allow for the leveraging of millions in private capital at the national level, something that my colleagues talk about all of the time. HFFI provides one-time loan and or grant financing to attract grocery stores and other fresh fruit retail to renovate and expand existing stores so they can provide the healthy foods that communities want and need. This financing will help local businesses through loans and tailored financing packages that is not readily available. Healthy food retail increases and stabilizes home values in nearby neighborhoods. It generates local tax revenues, provides workforce training and development, and promotes additional spending in the local economy generated by the store and the new jobs it creates. It actually has a multiplier effect. To know that this works, we just need to look at Pennsylvania. A similar program that began there in 2004 resulted in 88 projects being built or renovated in underserved urban and rural communities across the state. Today, more than 5,000 jobs have been created, and I know we all want to create jobs, have been created or retained, and 400,000 people now have increased access to healthy food. $30 million invested by the state has resulted in projects totaling more than $190 million. The Pennsylvania program success rate has been better than the grocery industry overall. Federal, state, and many city governments are enacting legislation and policies to attract healthy food retail. This is tremendous momentum around the country right now to bring grocery stores to places that need them. Also, a diverse group of nearly 100 stakeholders support this bill, including PolicyLink, the Reinvestment Fund, the Food Trust, the National Grocers Association, and numerous agricultural, health, civil rights, and industry groups support this bill. The Senate supports HFFI, not his bill. The Senate has recognized the case for HFFI and included this text in their bill. Food access is a critical problem. The good news is that we know what to do and we can do it. I ask that you stand with me in defending this HFFI by opposing the Schweikert Amendment, and I reserve.
Gentlelady reserves her time. The gentleman from Arizona.
Mr. Chairman, I reserve to close.
The gentlelady from Ohio has the right to close as a member of the committee.
Okay, thank you, Mr. Chairman. To the gentlelady from Ohio, you hit a couple points that I absolutely agree on. We have a horrible obesity epidemic. We have a crisis of nutrition of what people consume. If you really care about those things, then you would actually look at the Farm Bill overall and what we do in this country to distort what we consume. Walk down your grocery store aisles, and when you see what we've done, buy more government policies. But the fact of the matter is you actually in many ways make your own argument. If there's actually a program that you believe is working in Pennsylvania, then you've demonstrated the states are capable of doing this. But once again, to take another $125 million of federal money, create another program that ultimately actually does things like buys a grocery store. I mean, actually competes with a private business. I see something that's almost absurd in that if that's the way that this amendment ultimately works. And with that, Mr. Chairman, I reserve.
Gentleman reserves his time. The gentlelady from Ohio.
First, let me just say, and I thank the gentleman, certainly we can agree to disagree, but let's be honest, we are not buying grocery stores. And it is not accurate to say to the American people that is what we are doing, Mr. Chairman. So let me just make that clear. Secondly, if we have something that works, and we know that our people are in need, then I think that we should make it something that all of us can agree to do. Now, every state is not in the same situation. Every state doesn't have the same kind of vision that maybe the state of Pennsylvania had, but there are a lot of things that the states can do that they don't do and that all states don't do. So we want to be sure that every American has the opportunity to have decent, healthy food. So I think that this is in fact a good start. It was passed, my bill was passed bipartisan. I think it's good. And I think that for someone to just come up and just take pot shots at something that they don't even really clearly understand is unfair to the American people. Because if it was understood, they would know that we are not buying grocery stores. I yield back.
Gentlelady yields back her time.
Yes, I would be happy to yield.
May I ask the gentleman how much time?
The gentlelady has 15 seconds remaining.
Well, Mr. Speaker, I would just say, members, you know your districts. Some of you do have food deserts, whether you be in rural or urban areas. This is important. We want people to spend those food stamp dollars wisely. This gives them an opportunity to do so. This is not a Democrat or Republican issue. This is a common sense, good health issue.
Time of the gentlelady has expired.
Or we should defeat the Schweikert Amendment. Now yield back.
Thank you.
Gentleman from Arizona is recognized.
Mr. Chairman, may I request my remaining time?
Gentleman has 2 minutes remaining.
No, I didn't. I reserved.
He reserved his time.
I checked the transcript. Mr. Chairman, it may be a little unprecedented, but I want to actually give my friend Dr. Burgess, even though he's on the other side, 30 seconds of my time.
And I appreciate the gentleman for yielding. Seems a little strange for me to be lecturing you about a desert, but, Mr. Speaker, it is true. There are food deserts in both Republican and Democratic districts all over this country. People without access to fresh foods or healthy foods. Look, I don't think it's right that people buy processed foods and soft drinks with food stamps, but if they've got no other choice, what are they going to do? This initiative allows people to have the option to purchase healthy foods, get those micronutrients that they need to keep them healthy. Let's keep them out of the doctor's office. Let's keep them out of the hospital. I thank the gentleman for the recognition. I urge defeat of the Schweikert Amendment.
The gentleman from Arizona has 1.5 minutes remaining.
Thank you, Mr. Chairman. I'll try to be fast at this. And I want to also, the gentlewoman from Ohio, actually, I want to be careful in my language because I did say purchase grocery stores. It's basically finance their acquisitions through loans and other mechanics. It's still, and it would be unfair to use the cylinder type because that has a, but it is that mechanic of doing those loan mechanics and those things, and eventually the taxpayers do have money out in risk in that fashion. Look, for many of us here, we see an amendment like this, we see the well-meaning nature of it, but the underlying cause of much of this is the global policy we engage in, and we have for 60, 70 years. And we seem to be, if you look at all the amendments and really dig through this Farm Bill, I believe you will see layer after layer after layer where we're trying to fix sins that we created with our last attempt to fix this a mistake. I appreciate we have a crisis in parts of our country, whether it be access to healthy foods, whether it be obesity, but a $125 million program that creates special grants, special purchases, special loans, this isn't the way you get there to fix that. And with that, Mr. Chairman, I yield back.
The gentleman yields back his time. The question is on the